Hey, welcome back to the channel. I think the last time I did a video was the week that my cousin had passed away. I was not in a good place. And I told you that I was going to have some pretty serious surgery done. Well, I've had the surgery done. On the road to recovery because the CVID and some other health issues that I have are making it a little more difficult to heal. My incision when they took the staples out wasn't closed. I've had some infection issues, but I'm on the mend. Today I drove myself somewhere by myself for the first time. I'm still extremely sore and very weak, but this is what happened. I had been having some issues like abdominal pain, bloating, back spasms, and they would say, well, it's your IBS or it's side effects from your HIQVIA, which are all very real possibilities. But this particular day was Friday, September the 13th. Friday the 13th seems like a good day to get bad news, doesn't it? It was just too bad to handle, so we went to our primary care doctor, and she sent me for a CT scan thinking that I had an appendicitis. Was not an appendicitis. It was a mass larger than a grapefruit on my left ovary. Now, my primary care doctor is not an oncologist. She's not a gynecologist. She's a primary care doctor, and I think she's a fantastic doctor. But she was convinced that it was cancer because of how fast it grew, because it was pushing against my intestines. We then went to see a gynecologist who kind of agreed with her and felt like it could be cancerous. They did a CA-125 test that was a little bit elevated. So then from there we went to UAB to see an oncologist, a gynecology oncologist. She told me to be prepared to have possibly part of my intestines removed, all of the lymph nodes from my groin and some from my lower aortic area removed, and something called a fat pad would have to be removed along with both of my ovaries because she felt like it could be cancer as well. So I had to live with that possibility from September 23rd until October the 4th, I believe, is when they did the surgery. It was not cancer. And I know people can think what they want, but I know 100% that that was a miracle from God because they felt certain I had ovarian cancer. When she got in there, it did not look like cancer. There was no involvement with my intestines or anything else, so she didn't see a need to remove anything but the mass in both of my ovaries, which was a blessing. She did pathology, of course, on it, sent it off to a lab to make sure there were no cancerous cells present, and there were not. And that's all, I give all the glory to God for that because I don't have cancer and I know it's God. Healing is difficult from this surgery. I have never experienced pain like that in my life. I cannot take prescription pain medicine of any kind. All of it makes me throw up, and you certainly don't want to be throwing up when you have a belly full of staples and stitches. So I can take any prescription pain medicine. So that I was in an extraordinary amount of pain, and the anesthesia had made me sick. So for about, I would say about a week and a half, I was miserable. I lived on ice chips and broth and Tylenol and Motrin, and had to have my husband help me get up and down off the couch because that's how bad the pain was. Definitely on the road to recovery, but here's the point that I want to make with this video. One, God is the ultimate healer. So just because a doctor tells you they feel like you have cancer, don't cling to that, because I did. I was terrified, and I was depressed, and I was in a very bad emotional state, thinking that I was about to die of ovarian cancer. And it wasn't cancer at all. There was absolutely zero cancer when they did the surgery itself. So don't just rely on a doctor's opinion. Know that God is the ultimate healer. Also, if you have pains like I did, and not just necessarily the abdominal pain and bloating, but anything that seems off to you, and you go to the doctor and they say, well, we think it's just this, may well be. But if that pain doesn't go away, keep going and keep pushing and keep asking for more testing, because you know your body better than anybody else does. And your doctor is going to make decisions based on what you tell them. So if you are continuing to have these kind of issues, you really need to push for it and let them know how serious your pain is, because mine had gotten to the point that I couldn't take it anymore. I am, like I say, on the road to recovery. I still have to go to the wound treatment center because my incision is not closing correctly. I am very far behind on my CVID infusion treatments, because you can't really get an infusion treatment in your belly when you're healing from surgery. So this Saturday I'll have my first infusion treatment since the surgery, and there's still some debate as to whether I'll get the infusion of Hycuvia in my stomach or in my thighs, which I'm really not thrilled about. If you've had them done, if you get Hycuvia infusions and you've had them done in your thighs, I would love to know in the comments below how you reacted to that, because my fear is I've heard that it can make you more susceptible to getting blood clots if you have them done in your thighs. So if somebody out there's had that done, I'd really like to know your thoughts in the comments. Hopefully I'll be back on my normal schedule of making videos a little more often now that the weather's getting cooler outside. Hopefully we can get out and do some things and do little adventure videos. But it's also flu season, so we have to be very careful about being around crowds or people. I don't even like to go to the grocery store because it's dangerous to me. And that's another topic, is do you get a flu shot? My immunologist recommends that I don't, because I wouldn't build up an immunity to it anyway, and it's not exactly, how do I put this without making a huge big deal out of it, but when they make up the flu shot, they're guessing at what strain of the flu is going to hit that year. So they don't, it's not a guaranteed thing that you're not going to catch the flu if you get a flu shot. But I would like to know what your doctor tells you about, if you have CVID, what your doctor tells you about getting a flu shot. I'd be just kind of curious to know about that. And we'll be back soon with some more videos. Bye.